All right, in this video, we're going to talk about putting together a treatment plan, and we're specifically going to talk about the spinal treatment recommendations that AcuGraph makes. And so here, when we're looking at a graph, we just click on the Spinal tab, and we have a picture of the spine. And you'll see some areas are shaded. Some are more red, some are just slightly red, and some are not shaded at all. The more shading, the more red that you have in any particular area, the more likely there is to be a spinal issue there, a fixation, a subluxation, a lack of proper movement, and that's based on the findings of the AcuGraph exam. So in this case, you can see that for this patient, T8 and T12 are both likely suspects where there may be a spinal problem. Now, of course, this doesn't diagnose a spinal problem. It only tells you areas that you might want to go examine. And then you can look at each of these. So for example, with T8, we can see that that's associated with gallbladder, kidney, liver, pericardium, spleen, and stomach. All of those can be affected by T8 or can affect T8. So that tells us then that we have potentially an issue there based on those meridians. It also says that potentially there are these muscles associated. So if I look at the patient's graph, we can see that we have pericardium, small intestine, spleen, and kidney all out of balance. And so when I go to the spinal tab, pericardium, small intestine, spleen, and kidney, there they are. It tells me about associated muscles that may be involved. And so you can look at musculoskeletal issues and you can make correlations with what may be going on with the patient's graph. It's useful for helping the patient understand their pain, and it's useful for helping you devise a treatment plan.